Hello students, welcome to the lecture on Indian scenario, and after this lecture we will be able to learn the following objectives. Discuss the role of manufacturing in the Indian economy, define the top companies in India, discuss the pharmaceutical industries in India, understand the major pharmaceutical companies in India, describe the government initiatives, investment and challenges and future growth. Let's start with the introduction. Organizations are at present in the midst of a revolutionary transformation, that of competition shifting from industrial age to information age. During the industrial age, companies succeeded by how well they could capture the benefits from economies of scale and scope. Technology was important, but ultimately success accrued to companies that could embed the new technology into physical assets that offered efficient mass production of standard products. The emergency of the information era, which started in the last decades of the 20th century, made obsolete many of the fundamental assumptions of industrial age competition. According to a recent report from World Bank on global economy, developing countries over the next 10 years will grow by nearly 5% a year, compared with a rate of 2.7% in the rich industrial world, and by 2020, India should be the fourth largest economy in the world. Manufacturing is the process of adding value to raw materials and resources and is at the heart of an economy. The last decade has witnessed fierce competition in the international markets led by Japan and the newly industrialized countries' major competitive advantage. Let us now discuss the role of manufacturing in the Indian economy. Manufacturing holds a key position in the Indian economy, accounting for nearly 16% of real GDP in FY12 and employing about 12.0% of India's labor force. Growth in the sector has been matching the strong pace in overall GDP growth over the past few years. For example, while real GDP expanded at a CAGR of 8.4% over FY05 to FY12, growth in the manufacturing sector was marginally higher at around 8.5% over the same period. Consequently, its share in the economy has marginally increased during this time to 15.4% from 15.3%. The subsectors that stand out in India's manufacturing sector. Among subsectors in manufacturing, the top 5 are food products, basic metals, rubber and petrochemicals, chemicals and electrical machinery. Together, they account for over 66.0% of total revenues in manufacturing. However, these verticals rely primarily on domestic demand for a major part of their revenues. Manufacturing sector's recent growth spurt, clues from IIP. Manufacturing accounts for a large chunk of Indian industry, a fact borne out by the sector's 75.5% share in the Index of Industrial Production IIP, with CAGR of 8.7% during FY05 to FY12. FY12 includes data from April 2011 to February 12. The manufacturing sector helped the overall industrial sector get over low growth in the other two sub-segments of IIP, mining and quarrying, 14.2 weightage in IIP, and electricity, 10.3 weightage in IIP, witnessed CAGR of 3.4% and 5.8% respectively. Now let us discuss about pharmaceutical industry in India. The Indian pharmaceutical industry currently tops the chart amongst India's science-based industries with wide-ranging capabilities in the complex field of drug manufacture and technology. A highly organized sector, the Indian pharmaceutical industry is estimated to be worth $4.5 billion, growing at about 8 to 9% annually. It ranks very high amongst all the third world countries in terms of technology, quality, and the vast range of medicines that are manufactured. It ranges from simple headache pills to sophisticated antibiotics and complex cardiac compounds. Almost every type of medicine is now made in the Indian pharmaceutical industry.
India is a booming market for pharmaceuticals. Currently, we are the third largest producer of pharmaceuticals worldwide. Backed by a strong technology base and the quality and range of medicine produced, the Indian pharma market is expected to grow at an annual rate of 6 to 8% until 2015. Depending on which growth scenario you choose, the Indian pharmaceutical market volume is expected to reach 55 billion or even 70 billion US dollar by 2020. So we are talking about a huge market that is rapidly evolving. Also, we are convinced that the Indian pharmaceutical industry is well positioned for sustainable growth. It is very important for pharma companies to analyze both growth drivers and challenges in order to develop the right strategy for sustainable growth. This could be expanding the generic space or market reach or increasing R&D investments to improve the product pipeline. I think it is important that companies in the industry utilize available expertise in pharma productions and choose the right partners for implementing their business strategies. The challenges in India are largely the same as everywhere else. Patents expiring, growing price pressure from the market, and the need to perform better in terms of product quality and quality control. But we have some very unique opportunities as well. More people will gain access to healthcare programs and receive treatments. More people will be able to spend more on their personal healthcare. The pharmaceuticals industry in India needs to embrace both the challenges and the opportunities, and I'm looking forward to guiding our customers through the changes in the pharma landscape. As a technology house, we are proactively researching innovative technology and improving existing solutions to be able to come up with the right answers when our customer needs them. We have a strong organization and local expertise here in India, and we have excellent access to the team of experts at our German headquarters, ensuring that Indian customers get world-class solutions locally from Siemens India.
The government has also played a vital role in the development of the Indian software industry. In 1986, the Indian government announced a new software policy which was designed to serve as a catalyst for the software industry. This was followed in 1988 with the World Market Policy and the establishment of the Software Technology Parks of India (STP) scheme. In addition, to attract foreign direct investment, the Indian government permitted foreign equity of up to 100% and duty-free import on all inputs and products. Current scenario: Indian pharmaceutical industry is expected to grow at 19% in 2013. India is now among the top 5 pharmaceutical emerging markets. There will be new drug launches, new drug filings, and phase 2 clinic trials throughout the year. On back of increasing sales of generic medicines, continued growth in chronic therapies, and a greater penetration in rural markets, the domestic pharmaceutical market is expected to register a strong double-digit growth of 13 to 14% in 2013. Diagnostics: outsourcing clinical trials. According to the estimates, the Indian diagnostics and labs test services, in view of its growth potential, is expected to reach rupees 159.89 billion by 2013. The Indian market for both therapeutic and diagnostic antibodies is expected to grow exponentially in the coming years. Findings from the report suggest that more than 60% of the total antibodies market is currently dominated by diagnostic antibodies. Some of the major Indian pharmaceutical firms, including Sun Pharma, Cadila Healthcare, and Piramal Life Sciences, had applied for conducting clinical trials on at least 12 new drugs in 2010, indicating a growing interest in new drug discovery research. Generics. Generics will continue to dominate the market, while patent-protected products are likely to constitute 10% of the pie. till 2015 according to McKinsey report India Pharma 2015. Unlocking the potential of Indian pharmaceuticals market, Dr. Reddy's Laboratories Limited has launched fine asteride tablets, a bioequivalent generic version of Propecia fine asteride tablets in the US market. The tablets are used for treating male pattern hair loss. Growth of import-export. Imports. As per the Directorate General of Commercial Intelligence and Statistics, DGCIS, in the year 2010-11, the imports shown declined in growth compared to previous year. The country is almost self-sufficient in production of most of formulations pharmaceuticals products. As such, imports are being resorted to on quality and economic considerations and not necessarily due to non-availability from domestic sources. Manufacturers of drugs and pharmaceuticals are free to produce any drugs approved by the drug control authorities. Advantages in India. The Indian pharmaceutical industry particularly has been the front runner in a wide range of specialties involving complex drugs manufacture, development and technology. With the advantage of being a highly organized sector, the pharmaceutical companies in India are growing at the rate of $4.5 billion, registering further growth of 8 to 9% annually. More than 20,000 registered units are fragmented across the country, and reports say that 250 leading Indian pharmaceutical companies control 70% of the market share, with stark price competition and government price regulations. Competent workforce. India has a pool of personnel with high managerial and technical competence as also skilled workforce. It has an educated workforce and English is commonly used. Professional services are easily available. Cost-effective chemical synthesis. Its track record of development, particularly in the area of improved cost-beneficial chemical synthesis for various drug molecules, is excellent. It provides a wide variety of bulk drugs and exports sophisticated bulk drugs. Legal and financial framework. India has a 53-year-old democracy and hence has a solid legal framework and strong financial markets. There is already an established international industry and business community. Information and technology. It has a good network of world-class educational institutions and established strengths in information technology. Globalization. The country is committed to a free market economy and globalization. Above all, it has a 70 million middle-class market which is continuously growing.
Globalization has propelled a massive growth in a number of sectors of the Indian economy. Ten years back, job prospects for a pharmacy student were very limited. But today, the pharma sector has carved out a new phase for itself. With a growth rate of around 17%, the Indian pharmaceutical industry has emerged as the third largest producer in the world by volume and is geared up to grow from current $12 billion to $20 billion industry by 2015. Expanding at the same pace, pharma sector is expected to generate around 1 million new jobs in the next 5 years.
Today, pharmaceutical industry is in fact struggling to retain talent in all these areas, even with lucrative compensation packages, talent development programs, together with offering a very bright career path. This happens mainly because the demand for talent far outweighs their supply, especially in the area of pharmacy.
Today, emerging fields in the pharma sector have a lot to offer in terms of job opportunities. Biotechnology. Career in biotechnology is an invitation to participate in the development of new products and processes to improve the quality of human life. One of the fastest growing areas in this domain is advanced products in medical devices like stents, angiograms and brain-kidney catheters. After IT industry, biotechnology is considered to be the second fastest growing sector of the world. Clinical research organizations. India is seeking to become a major player in outsourced clinical research as well as contract manufacturing and research. Clinical research organizations within India have also been growing rapidly year on year, opening a number of opportunities for students pursuing in this domain. Production and manufacturing. Not only pharmaceutical companies, but also industries like soaps, cosmetics, toiletries and dental care products hire pharmacy professionals, which may extend to units like biological and biotechnological products, surgical dressings, medical devices and equipments, Ayurvedic, homeopathic, veterinary medicines, perfumery and fragrances, and nutraceuticals also hire pharmacy students. Research and development. Considered as a pillar to growth and sustenance, R&D forms the heart of any industry today. Job potential in this sector is mounting day by day. Analysis and testing. Any drug or dosage form for human consumption has to be free from any impurities with excellent quality and purity. That makes quality control and quality assurance as the most integral areas of drug and pharmaceutical industry. Nothing could be more satisfying than being a part of the backbone of the pharma sector. Marketing. Sales and marketing are vital components to carry out any business activity. Today, pharma sales and marketing, along with widespread opportunity in burgeoning service sectors like modern hospitals and diagnostics, offer excellent opportunities for the pharmacy graduates across the country. With the impression of global economy getting deeper, geographical barriers have become obsolete. For a pharma student, there are plenty of higher education and research opportunities, along with highest rewarding careers across the world. One of the significant players in the ecosystem of the pharma industry are the Pharma Schools of India. SVKM's NMIMS, where we define technological, management and organizational research with a view to create a cadre of employable individuals. Under the umbrella of NMIMS, Shobha Ben Pratap Bhai Patel School of Pharmacy and Technology Management was established in 2006 to develop a model pharmacy school of international standards and to inculcate research trends in pharmaceutical sciences and technology management in India. With excellent lab facilities, today the school is conducting various graduate, postgraduate and research programs in pharmaceutical sciences at its Mumbai and Shirpur campuses. The school has highly experienced faculty who encourage students to carry out research in the fields of their interest. Our tailor-made innovative courses are designed after constant consultation with the industry and renowned academicians of national level. These courses are ready to fulfill any challenges of the pharma industry.
Apart from offering B.Pharm and M.Pharm courses, we also offer integrated 5 years MBA Pharma Tech course with dual degree in Pharmacy and Technology Management, which has edge over other courses which are being offered by rest of the country.
At the School of Pharmacy, excellent teaching and learning practices are based majorly on student feedback systems.
I'm very happy about my decision of joining School of Pharmacy and Technology Management, as today I'm working with one of the largest Indian pharma companies in their corporate strategy group. I came in with high expectations, and I must thank everyone at School of Pharmacy and Technology Management and all its stakeholders for helping me not only with my expectations but my insecurities and also, most importantly, my dreams.
Come, start a career where you can make our planet a healthier place to live in.
Let's now discuss some of the major pharmaceutical companies in India one by one. Ranbaxy. Ranbaxy is among the predominant pharmaceutical companies in India and was founded in 1961. Ranbaxy is a research-based pharma giant and became a public limited company in 1973. Ranbaxy was recently ranked among the top 10 international pharmaceutical companies in the world, have presence across 49 countries. Ranbaxy is also reputed for its 11 state-of-the-art manufacturing facilities in countries like China, India, Brazil, South Africa and Nigeria. The company has also won several awards and recognitions for its pioneering initiatives in the developing markets of the world. Ranbaxy is also a member of the Indian Pharmaceutical Alliance, an organization of pharmaceutical producers of India. In the present scenario, Ranbaxy commands more than 5% share of the Indian pharmaceutical market. Ranbaxy's operations in India are designed under as many as 9 SBUs, which take care of the various categories of medicines and drugs that are manufactured by Ranbaxy. The company is especially well known for having the highest research and development R&D budget among pharma companies in the world, which is as high as $100 million. Ranbaxy India operations are handled by 2,500 employees, and the company's market share in India is worth around $6 billion. Dr. Reddy's Laboratories. Dr. Reddy's Laboratories is one of the popular pharmaceutical companies with base in more than 100 countries. The medicines of Dr. Reddy's Laboratories Limited are easily available all across the globe. Dr. Reddy's pharmaceutical company is very much customer friendly. It takes care of the fact that maximum people get benefited by the products of this pharmaceutical company. It commercialized various treatments so as to provide high-tech treatment to the masses. It tries to meet the medical needs of the people. Though Dr. Reddy's Laboratories is located in various parts of the world, it has its headquarters in India. The subsidiaries of this company are found at various countries like US, Germany, UK, Russia and Brazil. 16 countries have the representative offices of Dr. Reddy's Laboratories Limited. 21 countries have third-party distribution. Cipla. Cipla was founded by Khwaja Abdul Hamid in 1935 and was known as the Chemical, Industrial and Pharmaceutical Laboratories, though it is better known by the acronym Cipla today. Cipla was registered in August 1935 as a public limited enterprise, and it began with an authorized capital of Rs 6 lakh. Though set up in 1935, it was only in 1937 that Cipla began manufacturing and marketing its pharmaceutical products. Today, the company has its facilities spread across several locations across India, such as Mumbai, Goa, Patalganga, Kurkumbh, Bangalore and Vikhroli. Apart from its strong presence in the Indian market, Cipla also has an extensive export market and regularly exports to more than 150 countries in regions such as North America, South America, Asia, Europe, Middle East, Australia and Africa. For the year ended 31st March 2007, Cipla's exports were worth approximately Rs 17,500 million. Cipla is also considerably well known for its technological innovation and processes, for which the company received know-how loyalties to the tune of rupees 750 million during 2006-2007. Sun Pharmaceuticals. Sun Pharmaceuticals was set up in 1983 and the company started off with only 5 products to cure psychiatric illness. Sun Pharma is known worldwide as a manufacturer of specialty active pharmaceuticals ingredients and formulations. However, the company is also concerned with chronic treatments such as cardiology, psychiatry, neurology, gastroenterology, diabetology, and respiratory ailments. Active pharmaceuticals ingredients API includes peptides, steroids, hormones, and anti-cancer drugs, and their quality is internationally approved. The international offices of Sun Pharmaceuticals Industries Limited are located in British Virgin Islands, Russia, and Bangladesh. In India, the offices are in Vapi, Silvassa, Panoli, Ahmednagar, and Chennai. There are 3 major group companies of Sun Pharmaceutical Industries. Caraco Pharmaceuticals Laboratories, based in Detroit, Michigan. Sun Pharmaceuticals Industries Inc., Michigan. Sun Pharmaceuticals, Bangladesh. Aurobindo Pharma. Aurobindo Pharma, an Indian-based private pharmaceutical company having presence around the world. Aurobindo Pharma was set up in the year 1986 and started its operations in 1988-89 in Pondicherry, India. Now the company is headquartered at Hyderabad, India. Aurobindo Pharma is one of the most respected generic pharmaceuticals and active pharmaceutical ingredients API manufacturing company of the world. Aurobindo Pharma operates in over 100 countries across the world. Further, the pharmaceutical major markets are over 180 APIs and 250 formulations throughout these destinations. This Indian pharmaceutical major has filed over 110 DMFs and 90 ANDAs for the USA market. So far, Aurobindo has received 45 ANDA approvals, both final and tentative, from USA alone. Aurobindo Pharma products cover segments like antibiotics, antiretrovirals, CVS, CNS, gastroenterological, anti-allergic.
Presenting Aurobindo Pharma, a company committed to healthier life. A truly global company, present across 125 countries, has entered $1 billion league. Aurobindo Pharma has 14 large manufacturing facilities with approvals from stringent regulatory authorities like US FDA, UK MHRA, TGA Australia, GCCDR, ANVISA Brazil, etc. Aurobindo Pharma is a scientifically strong company with 8,000 plus multinational human resource, including 800 plus scientists. Aurobindo Pharma has received 146 US FDA approvals and 92 approvals from European Union, and is actively exporting products to the USA and European Union. Built on robust infrastructure, Aurobindo Pharma is also one among the leading global generic manufacturers of antiretroviral drugs. Aurobindo Pharma's entry onto the shores of Gulf Cooperation Council is not only a groundbreaking, but a definitive event of this generation.
Let us move to next topic, government initiatives and investment. The Indian government is very proactive for boosting growth and investment in Indian pharmaceutical sector. It allows 100% FDI under the automatic route in the drugs and pharmaceutical sector. The DIPP data suggests that the drugs and pharmaceutical sector has attracted an impressive level of FDI worth $1,882.76 million during April 2000 to March 2011. Industrial licenses are not required in India for most of the drugs and pharmaceutical products. Manufacturers are free to produce any drug duly approved by the Drug Control Authority. This patent regime has led to the investment from many pharmaceutical multinationals in India. Now they are looking at India not only for its traditional strengths in contract manufacturing, but also as a highly attractive location for research and development, R&D, particularly in the conduct of clinical trials and other services. Indian and foreign companies are continuing with patented drug launches in India, and between 2005 and 2010, the Indian Patent Office has granted 3,488 product patents as per a KPMG report. Government initiative. The Union Finance Minister highlighted few points in Union Budget 2012-13. It is proposed to extend concessional basic customs duty of 5% with full exemption from excise duty, CVD, to 6 specified life-saving drugs, vaccines. These are used for the treatment or prevention of ailments such as HIV, AIDS, renal cancer, etc. Probiotics are a cost-effective means of combating bacterial infections. It is proposed to reduce the basic customs duty on this item from 10% to 5%. Basic customs duty and excise duty reduced on soya products to address protein deficiency among women and children. Basic customs duty and excise duty reduced on iodine, marking a new trend of investments from foreign players in the Indian pharma sector. The need for overseas investors to get a no objection from their JV partner before venturing out on their own or roping in another local firm has been removed by the Pharmaceuticals Export Promotion Council, Pharmaceutical. It is expected that this measure will promote the competitiveness of India as an investment destination and be instrumental in attracting higher levels of FDI and technology inflows into the country. The Department of Pharmaceuticals has prepared a Pharma Vision 2020 document for making India one of the leading destinations for end-to-end drug discovery and innovation, and for that purpose, the department provides requisite support by way of world-class infrastructure, internationally competitive scientific manpower for pharma research and development, R&D, venture fund for research in the public and private domain, and such other measures. Investment. Israel-based Teva Pharmaceuticals, in collaboration with Procter & Gamble, P&G, plans to set up world's largest over-the-counter OTC medicine facility at Sanand, Gujarat. GlaxoSmithKline, GSK, and the Hyderabad-based Biological E Limited have teamed up for early-stage research and development, R&D, of a 6-in-1 combination pediatric vaccine against polio and other infectious diseases. Claris Life Sciences Limited has entered into joint venture JV agreement with two Japan-based drug makers, Otsuka Pharmaceutical and Mitsui & Company Limited, for its injectable business in India and other emerging markets. Nipro Corporation has set up India's first dialyzer manufacturing facility at Shirwal near Pune with an investment of rupees 700 crore, 130.60 million US dollars. Aurobindo Pharma Limited has received approval from the US Food and Drug Administration, US FDA, to manufacture and market various medicines, namely oxacillin injections and rizatriptan benzoate tablets in the US, besides nafcillin and ondansetron injection. Eli Lilly and Strides Arcolab have inked a pact to increase delivery of cancer medicines in emerging markets. Agila Specialities, the specialties division of Strides Arcolab, will make cancer medicines, and Eli Lilly will market them in emerging geographies. Let us now study the challenges and future growth on pharmaceutical industries. Challenges. Over the past decade, pharmaceutical companies have entered a difficult period where shareholders, the market, and regulators have created significant pressures for change within the industry. The core issues for most of the drug companies are declining productivity of in-house R&D, patent expiration of number of blockbuster drugs, increasing legal and regulatory concern, and pricing issue. As a result, larger pharmaceutical companies are shifting to new business model with greater outsourcing of discovery services, clinical research, and manufacturing. Current global financial conditions and the threat of a broad recession accelerated the timetable for implementing transformational changes in global organizations as the industry confronts lower corporate stock prices and an increasingly cost-averse customer. Leaders of the largest global pharmaceutical companies recognize the need for transformational change in their organizations, but will need to move swiftly to ensure sustained growth. The Indian stock market may be dreading a possible recession, but Indian pharma companies seem unfazed by slowdown fears. Riding on better sales in the domestic and export markets, Indian pharmaceutical industry is expected to continue with its good performance. Today, Indian pharmaceutical industry can look forward to the years to come with great expectations. There are opportunities in expanding the range of generic products as more molecules come off patent, outsourcing, and above all, in focusing into drug discovery as more profits come from traditional plays. At the same time, the Indian pharma industry would have to contend with several challenges, particularly the effects of new product patent, drug price control, regulatory reforms, infrastructure development. Future growth. India will see the largest number of merger and acquisitions, M&As, in the pharmaceutical and healthcare sector, according to consulting firm Grant Thornton. A survey conducted across 100 companies has revealed that 1/4 of the respondents were optimistic about acquisitions in the pharmaceutical sector. Now, in the end, let us summarize what we have learnt in this lecture. For a country such as India, which needs high growth levels to generate enough resources to alleviate poverty levels, decline in competitiveness is dangerous prognosis. Globalization refers to the trend towards countries joining together economically. India is currently the largest producer of textiles, chemical products, pharmaceuticals, basic metals, general machinery and equipment, and electrical machinery. Sun Pharma is known worldwide as a manufacturer of specialty active pharmaceuticals ingredient and formulations. The Indian pharmaceutical industry particularly has been the front runner in a wide range of specialties involving complex drugs manufacture, development and technology.